my questions were because I'm interested in going to grad school for forensic clinical psychology. And I don't want to get my PhD. I'm interested in getting my PsyD. So I don't know if you know like a straight route for that or not, because I know like I have a few options of what my end goal career I want it to be. Like I want to be either being DFBI working as a forensic psychologist for them, or a jury selection consultant, and or I most likely just want to work with like the criminal justice system, either in the prison system or in the courts.
Yeah, and I mean, all of those are, I mean, they all sound in the forensic psych realm. So it sounds like you're looking in the right area. Okay, so you had a couple different thoughts going on. Tell me, so tell me again, what can I help you like explore with your, I mean, it sounds like you've got a lot of different areas of interest, right? And you said you're interested in like a PsyD in particular. Does that mean you're more interested in like applied stuff, and so you want to go more into a clinical degree and less into research? Is that sort of the idea?
Yes.
Okay. So yes, actually, I think, I mean, I don't want to say this like this, but I know people from PsyD programs that did really well in forensic psych, you know, because a lot of it is very applied, you know, and that's kind of what PsyD is a doctor of, you know, clinical psychology, where you're, you know, maybe compared to a PhD, you're sort of more applied oriented than, you know, research oriented or whatever. So yeah, that's totally, and actually there was a PsyD JD program that I looked into. It was at Pacific Graduate School of Psychology in California. They had a PsyD JD with, what was the law school? I can't remember what the law school was. But anyway, so yes, definitely if you're more interested in sort of the action and applied side generally, like you can find programs that suit that interest all the way through. And I haven't seen that in any way that would be, you know, perceived as a deficiency as you get into internship and things. I mean, internships like to see that people have some practical training because they want you to do a lot of practical work while you're there, you know. So I've never seen that a PsyD really highly, you know, unless maybe you're, you know, it's some program that just happens to like tout themselves as a research one institution, and, you know, they just want to make sure that their people publish something while they're there, you know, whatever. But in the general scope of the field, and again, I'm happy to talk to you. I mean, you mentioned several different possibilities, so I'd be happy to be more specific or have another conversation. But yeah, the PsyD piece would work naturally and well, I think, going into this area.
So one of the questions, I think Fola brought up a couple of things that are also in other students' questions, like somebody asked, what are the possible graduate paths to take to go into the forensic psychology career field, not just PsyD? And I know they always ask about this, like, can you do it with a master's degree? You kind of addressed that. And then they also want to know where most psychologists end up working after school. And that, to me, seems like it depends on what type of program they go to. So I don't know if you could speak to those two pieces in terms of like, if you do this, you can do this.
Yeah, so the master's degree piece, you're usually not, so with a master's degree, you're going to have a lot less opportunity to do formal training in diagnostics, like in other words, to see some really entrenched mental illness type thing, or for, you know, maybe following people over a longer period of time. You're going to have less opportunity to take assessment classes, which means you're figuring out and trying to diagnose all kinds of psychopathology and all of that thing. So can somebody be certified as an expert with a master's degree? I mean, remember, we're talking about the difference in like academic credentials and being, you know, certified by a court, which is idiosyncratic to courts, right? You know, I think it would tend, like, if that's your goal to be an expert witness in court, you probably want to go ahead and plan to have the highest credentials in diagnostics and psychopathology, which is a doctorate degree. But I don't think you're necessarily excluded from being an expert. You may have to certify yourself in a more narrow path that you've had an opportunity to be deeply trained in with a master's degree. So, you know, really anybody can be certified as an expert by a court if they can convince the court they're an expert. So, you know, formal training is one part of that. But, you know, of course, APA accredited programs are all doctoral programs in clinical psychology. So if you want to sort of use benchmarks like that, then, you know, probably the doctorate degree would be, you know, what you'd want to shoot for. But again, there's a lot of other things you can do. You know, that's to do the assessment and the reports for the courts, right? But there's a lot of other stuff you can do. I mean, people can work in prisons or in, you know, state psychiatric hospitals where people are being, you know, undergoing treatment to be restored to sanity, or, you know, there's all sorts of ways to interact with these systems if you're sort of interested in it generally. The piece that I've talked about is more the kind of forensic expert psychologists, like doing an evaluation thing, but there's a lot of other opportunities.
Mm-hmm. Yeah, I think that students often might have a misconception of what the majority of forensic psychologists do. And one of the students did kind of ask that. What do you think most people in the field are doing?
Well, a lot of people do, you know, private practice. So it's just like being licensed, you know, in your state. And then for any forensic evaluation, it's either going to be court ordered or you're going to be retained by one of the sides of the case. So most people that do forensic work are private practitioners, you know, that just like if I were going to go get some therapy down the street, you know, that's a private practitioner, and these individuals are just more focused and trained and concentrated in answering these psycholegal questions. I mean, one caveat to that is you're going to have, when you have like inpatient psychiatric issues that are relevant to the legal issues, that's going to be in like a psychiatric hospital. So the other part is, you know, the prisons, the psychiatric hospitals, there's other inpatient facilities where people may work, you know, you may be a Bureau of Prison psychologist. I mean, that may be your job. But the majority of folks that do these kinds of evaluations, I would say, are private practice that just focus in this area.
And those are all probably PhD level people, PhD level jobs, or some of those?
Yeah, or PsyD, so the doctorate of, and again, that's more of an applied versus a research angle. But again, I haven't seen that it's been, and so, you know, and generally, like, you know, if we're talking about like rigor of the program, maybe PhD would like, but I haven't seen that the PsyD has been a detriment to people internship wise or postdoc wise, especially in this field, in this area. Like, I think people just like you to be able to do the applied work and do it well. So whichever program you favor to get that done.
When you think of good PsyD programs, because I know that Polike is looking at programs, and I know of a few, but what pops out at you as a good program or two to apply to if it's PsyD?
Well, I mean, I definitely remember that. I'm trying to think. I feel like there was one other. And by the way, so even if you don't want to do a JD and a PhD in one of these combined programs, you might want to look at those doc programs because their faculty are still going to have orientations in those directions. So, you know, even if you don't want to do a bunch of degrees at the same time or whatever, those programs still may have these, you know, these interests that you all are exploring here. So, I mean, good PsyD programs, there's a lot of them. And actually what I would do, because the APA does accredit PsyD programs as well, they put out a guide each year of of the graduate programs, the APA does. And, you know, they rank them on all sorts of things and talk to you about, you know, and I think they're all, you know, updated at least annually or biannually or something. So you're kind of getting a review of the whole structure of the program and department, you know, updated each year. But that's a really good guide. I know I looked at that a lot. In this particular area, I'm trying to think, like, I know there was that Pacific Graduate School of Psychology group that maybe with Palo Alto, maybe that was the law school or whatever, but, you know, it's a PsyD program over there in California. I feel like one of the other JD, there was one at Villanova and Hahnemann, but I think that might have been a JD PhD program. Shoot.
When I'm still like looking at programs, do you have to like attend a school? Because I know most PsyD programs don't always have a forensic track. So would you suggest like looking at a program that has a clinical track, but just make sure you take internships within like a forensic setting?
It really depends, because I think you can do it that way, the more traditional route. And then, I mean, and I got through that way, you know, because I got the postdocs that I applied for and stuff, but I definitely felt like an outsider because the people that were streamlined into those things were people that were in these like JD PsyD programs, or, you know, came from a program that had a forensic track, you know, or like that wasn't really the focus of my program. And I went to a program like that on purpose. Like I wanted it to be a normal, like broad, whatever that, and that wasn't necessary, by the way. But I mean, I did get great training in diagnostics and assessment, but yeah, I think that, you know, what I saw as the more straight line was just people who knew they were interested in forensics, you know, that kind of just had that interest and went for it. And like I said, I worked in a program that was a clinical psych program that had a forensic emphasis, but that's somewhat rare at the graduate school level. But you'll find that at, like, you know, John Jay. What you'll want to kind of look for is just, yeah, whether they have a forensic track in their, or forensic opportunity in their practical training. Nobody's going to I mean, forensic psychology, other than taking a class to understand the psycholegal concepts, which you'll get on postdoc or internship or whatever you're doing the evaluations anyway, like what you're really actually talking about is figuring out whether you want to work with people who are, you know, interfacing psychology and law, you know, whether it's in the prison system or in, you know, an inpatient psychiatric hospital, or, you know, in a private practice where you're going to jails and interviewing people for their competency, or, you know, whatever. I mean, to me, that's what the experience is. That's where all the experience came, was just making sure you have a practical opportunity like that, to be trained closely and to be closely supervised in that kind of setting, because I think that's where you figure out whether it's for you or not, you know?
Those are the questions to ask the programs that people are applying to. Do they have these specific practical?
Exactly. And I think that APA guide that they put out each year, I think it will have actually a list of their different tracks. So you can kind of see, do they have practical training in forensic? You know, I would imagine that's something they would include, especially because, like I said, this is kind of a hot area of interest. And so I think programs would want to feature that aspect if they're doing forensic training.
So I want to squeeze in two questions. One, I think, is a quick response. One thing I see a lot from students is thinking they're going to be a criminal profiler. How rare is that's what people are doing? Do you know, like, the percentage of people doing that?
Yeah, like, I don't really know anybody who's doing that personally. You know, there is, I mean, the closest things that I think are oriented in that way are maybe doing like, and I almost was a CIA psychologist, so I almost went this direction, but I know there's some, you know, concept of profiling in that, but I don't even know the extent of it. I mean, I did the whole forensic psychology evaluation route. So any of that, you know, there was to learn, I had the opportunities and I mean, anyway, I don't want to get on a soapbox about profiling, but, you know, we in clinical psychology learn to evaluate individuals, and that's very much what you're doing in forensic mental health evaluations for the courts, you know. So the concept of predicting individuals at the, I mean, yeah, we that had to be another show.
Well, I talk about it in a lecture that, you know, generally psychologists don't believe that reliable, and if there's anybody out there doing it, it's like 1% of people in the field is what.
Yeah, I mean, I'm thinking like CIA, and then what was the other thing I was thinking that seemed kind of like that? Oh, I mean, actually, it kind of feels a little bit like, you know, industrial organizational kind of gets in that thing, you know, because they're kind of doing like just psychological profiles of people who are good employees and, you know, whatever. So it kind of has that flavor of like selectionism. But yeah, there's not a lot of people just out there like,
yeah.
It's not like on, I don't know. I don't even watch any of those shows anymore, so I don't know.
CSI is what I hear. What did you say?
I said Criminal Minds.
Yeah.
Okay. Yeah.
Students love that.
I haven't seen it, but I don't think it's like that.
And then the other thing that somebody asked, which might be a little long, but I don't know if you could succinctly talk about the most interesting case you've ever participated in. A student wanted to know. And I know you one time talked in class about somebody you had to determine their sanity or ability to stand trial. That was fascinating, but I don't know if you can think of one that you would share.
Oh, goodness. I mean, the person that comes to mind is actually that I really learned so much from, was actually a therapy client, not a person that I evaluated for the courts. This person had already been found not guilty by reason of insanity. The person was a Chinese woman who had murdered her mother with a concrete chicken in the yard, like years before. And just, it was a really interesting case because of the intersection. This is going to get really dorky for a second, but like the intersection of axis 1 serious mental illness and personality disorder, and how those intersect, because both of them were very prominent in this case. And this case was super fascinating for cultural issues around, you know, scrupulosity and religiosity and things like that, that were just, you know, really fascinating. This was an overachieving prodigy kind of person in terms of how she had been raised and her educational background, and then this event, right? So that was actually, like, when you said that, I was like, but then I'm like, you're like, you evaluated some really, I'm like, yeah, I've evaluated some very interesting. So I've done, you know, competence to stand trial evaluations, mental state at the time of the offense. You know, sometimes those things converge, sometimes they don't. You know, somebody can be completely competent to stand trial now, but have not known what they were doing at the time of the events, right? Somebody could have known exactly what they were doing, but they've decompensated and they're not ready for trial, you know, so they're two different questions. And like I said, you know, civil forensic too. So, you know, parenting evaluations and that sort of thing as well.
Mm-hmm. So the woman with who murdered her mother, and you said she had an Axis 1 and a personality disorder. What was the personality disorder?
Borderline. So she was, she had a very, those therapy relationships are always very interesting in just the dynamic, the therapeutic relationship dynamic. So it was just it was a great training case because I was able to really practice those therapeutic skills, like in a very sort of challenging case and situation. So, but yeah, that like I said, like forensic psychology or working at the intersection of psychology and law doesn't just necessarily mean you're doing these evaluations for the courts. I mean, you could be a master's level therapist and go into any of these settings and, you know, there are need therapists there, right? So, so yeah, there's a lot of different options. And it's funny that what just came to mind was a therapy case rather than an evaluation case. But I love the evaluation cases. I do miss doing those. So I don't do those currently. But
do you think, now this is just my personal interest. I mean, I've known you a long time. And one of the things that struck me about you early on was that you're so compassionate with people who are mentally ill. And I think that's uncommon. Do you think that you need that stance to do this work? Or do you see people who are like, I don't know, the doctor who lied at Andrea Yates' trial, who didn't seem very compassionate? I don't know.
Did they say he lied? Did they ever actually say that? Or
no, they implied that he made up a television show.
Wait, did they find that he like perjured himself or anything? I can't remember.
I mean, it sounds like it.
I know, but like you probably, anyway, whatever. And that's another soapbox. So does it help to be compassionate? You know what I was saying earlier though, how like I took a different approach to all this, and I think you have to be fascinated by it. You know, you have to have that fascination by it, but I don't think everybody's equally compassionate in the field. Let me, yeah.
The thing for like students' benefit, like if you know, I guess what I learned about myself, because I have a master's degree in counseling and I worked with some people who were ill, not that I wasn't compassionate, but it wasn't for me because I didn't feel like I could make the kind of difference I can make with students who are motivated and need help getting into careers. And so I was just wondering if you think that people should reflect upon themselves and their own ability to work with pretty sick people.
Absolutely. I mean, that's a part of it. And I think that's why the training shifts where you're interacting with those populations, because it's more than one population, is so important. That's the first thing for you to decide is whether it feels right, you know, because, you know, compassion can go a lot of different directions in that kind of situation. It's not always the most compassionate practitioner who's the best forensic evaluator, for example. Not that I don't think you can use all of those skills wisely, but, you know, nor do I think a non-compassionate forensic evaluator is very good. And there's plenty of people, you know, honestly, like if some people need to check something about themselves, it's you know, and I guess you can go into the field and just want to be like a superstar or something. I don't know. Like what's the myth about forensic experts? Like maybe it's like the TV thing or whatever. It just like seems so movie star somehow, you know? Like I think there is like a little bit of that movie star pull, like on some people that go in this direction, you know? So I think, you know, on one hand, I'm like, okay, well, they still wanted to be movie stars before and after they got into it. So that's okay, I guess. Do I think that necessarily makes the best for, like, I feel like I had more modest like interests in the field than that. Not that anything's right or wrong again, but you know, like it's, to me, it's great to have a purist in terms of just being interested in psychopathology or just really having an earnest interest in working therapeutically with people, you know, like that's all great. That's not what everybody's like in the field for sure. And I don't even know what the best approach is, but it is nice to have, you know, to be able to evaluate where you could fit in that way, you know, whether it takes something to be able to do, like you said, that therapeutic work with people and with, you know, challenging clients in particular. So.
Yeah. Well, the students, I hope, I'm going to squeeze in another talk with Dr. Mark Swager, who you haven't met, but I've talked about. I think Fola's class got a recorded video of him last year, and I'm going to try to do this, but he works with psychopaths, and he's funny.
Oh, yes.
He just takes a humorous approach to their lives and just like, whatever, dude. Yeah. But he's kind of sick of them and now moving on. So he said, he's like on to research.
It happens, you know, like it's definitely fill you up work, you know.
Yeah. Well, I really appreciate your time and
thank you for inviting me. It was so good to see y'all. Let me know if there's any follow-up questions or anything.
Okay. Thank you. Okay. I really appreciate you taking the time to answer my questions.
Absolutely. Best wishes. Y'all take care.
Bye.
Bye. Bye.